Let's listen to an expert doctor, Dr. Hitesh Yadav, for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart?
Hi everyone, myself Dr. Hitesh Yadav, Senior Consultant Cardiologist at Paras Hospital, Udaipur.
Doctor, can high blood pressure be completely cured?
Actually, there are two types of high BP, we say hypertension. One is primary and secondary. So that primary one we say idiopathic, when they are obscure reasons. So that primary one it's notable, not curable, and the secondary one, some etiologies are there, like some endocrine disorders, some renal issues. So these secondary one are treatable. So primary one are usually related to advanced age, in the young population, related to increased stress level and middle age body changes, like increase in body weight, or sometimes genetics also play a role. So in the both this idiopathic one and other factors, with the aging, the people are prone to develop risk factors like diabetes, hypertension, as mentioned, increase in body weight, and over this some imposing factors like habits of smoking, or having drink in excess, sedentary lifestyle. So these also make the person prone for having risk factors which lead to development of hypertension and finally some cardiac ailment also.
Doctor, has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
Yes, definitely. Nowadays we are seeing increasing number of young hypertensive as well as young heart attack and sudden cardiac death in young population. So previously we everybody thinks that cardiac disease are usually after 60 and maybe one decade later in the females. But now it is not so. Now we are seeing heart attacks and hypertensive patients even in their 30s or in the early 40s. So reason behind this is mostly it is unhealthy diet, sedentary lifestyle, stress, comorbidities, and so on. And with the COVID, we are seeing increasing number of these heart attacks. Though that vaccine is also being said culprit, but there is no valid data regarding that. So in the young hypertensive, what precautions should be taken are if they have some family history of such, or they that already mentioned lifestyle is sedentary, having work stress, or their sleep cycle is not they are not able to have sufficient sleep, or having other comorbidities already, increased body weight, or some might be having genetic or this lifestyle related development of diabetes. So such patient actually the thing is try to be active, and for stress they can have some yoga, meditation, or some other stress ending things. Try to have adequate sleep, and if genetic things are there, they should be monitored periodically. Every year they should have their body profile, metabolic, and cardiac workup also.
Doctor, what precautions should a patient take along with medications?
In terms of precaution, try to lose body weight. Shedding extra weight lead to either decrease in the doses of antihypertensive, or even some patient may be drug free after that. And meals or diet should be less in salt, and that dairy fat is okay in limiting amount, but try to curtail the simple sugars. And those who are drink, so they should limit their alcohol intake. The permissible limits are 2 packs, which is 30 ml per pack for male, and 1 pack 30 ml for female. That also something 3 to 4 days in a week, not daily. And it's tobacco is harmful in all. Whatever is harmful only. So there is never, and everybody should quit tobacco use in any mean, and because smoking is a major risk factor for cardiac illness as well as for stroke. We say that paralysis attack.
Public awareness initiative by Glenmark Pharmaceuticals.